Good morning, everyone. Thank you for joining Chew on This. The event will be starting momentarily, but we wanted to inform you that the conversation will be recorded and available on carequest.org after the event. I'll now hand it over to CareQuest Institute for Oral Health President and CEO, Dr. Myechia Minter-Jordan, to kick us off.
Thank you so much. I'm very excited to be with everyone today. I appreciate your joining. I'd like to wish you all a hello and welcome to our second episode of Chew on This. We are a live, action-oriented discussion series with key policymakers and influencers where we'll uncover opportunities to advance health equity and social justice. Our goal is that these conversations will challenge preconceived notions and offer practical opportunities to engage in public policy advancement. Today, I'm thrilled to be joined by Congresswoman Dr. Alma S, who represents North Carolina's 12th District in the U.S. House of Representatives. The Congresswoman is a dedicated public servant who has championed key pieces of legislation on healthcare access, food insecurity, and a more just and equitable society. Congresswoman Adams is also the co-founder and co-chair of the Black Maternal Health Caucus, which is a topic that we will focus on today. Congresswoman, thank you so much for being here. If you could, awesome. So wonderful to see you. Thank you again for being here.
Good to be here, and thank you so much. I really appreciate the opportunity to chat with you today.
Fantastic. Well, let's jump in. Black Maternal Health Week begins this week, and this topic is incredibly important for us to be discussing year-round. CDC data shows that Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women, with most of the maternal deaths being preventable. Can you tell us more about your work as co-founder and co-chair of the Black Maternal Health Caucus?
Well, thank you so much, and thank you for all that you're doing. This month, of course, marks the 5th anniversary of when Congresswoman Underwood and I founded the Black Maternal Health Caucus. Of course, my work is very personal. It began when my daughter almost became a victim of the crisis. A physician overlooked her complaints of pain in her abdomen, didn't listen to her needs as a Black woman, and not trusting that she knew her own body. And so their dismissal of the pain almost caused my daughter her life and the life of my granddaughter, who actually just went to her prom last night.
Oh, wonderful.
But this story, of course, hits close to home because it's common in our community. And over the past 5 years, I have continued to see how these inequities in our healthcare system have stolen countless moms. And so Representative Underwood and I, in response to the reality of all of the forms of inequality that Martin Luther King talked about in terms of healthcare, the fact that Black women, American women, are dying in childbirth at a rate much higher than other wealthy nations, and we're only 13 countries in the world where the rate of maternal mortality is worse than it was 25 years ago. So in response to all of that, we developed the Black Maternal Health Omnibus Act, which is a collection of 13 bills that provides a roadmap so that our healthcare systems will finally make Black maternal and infant health a priority. So we've continued to work over the past 5 years. We have a coalition of nearly 200 healthcare providers. We got input from including Black mothers and policymakers and so forth. And so these policies, of course, will help improve the maternal health outcomes for Black pregnant and postpartum individuals. So we'll continue to move that, and hopefully we'll get the full package passed.
Thank you so much for your work on that, and so many others. Really appreciate all of your efforts and recognition. And one of the things that always strikes me is often people think about this crisis involving Black mothers and Black women as being dependent on their social status. And it is not, as we know, it is regardless of social status and economic status. These issues impact Black women writ large. So thank you again for your work as co-founder and co-chair of that caucus. We also know from the work of CareQuest Institute research that approximately 60 to 75% of pregnant women experience oral health issues that raise the likelihood of poor birth outcomes and major complications. I know that this is a conversation that is just beginning, but I'd love to understand how you feel oral health access can factor into maternal health access and outcomes.
Well, thank you for that question. Oral health has a huge impact on maternal and infant health outcomes, and we haven't talked about it enough.
That's right.
So, despite its importance, oral health care is inaccessible to so many people. And for many families, preventative health care is out of reach. Typically, people only seek it when it's an emergency.
Mhm.
Growing up, the emergency room was my family's primary source of health care.
Mhm.
So a lot of Americans may seek out dental care, but they don't really do it until the symptoms are so unbearable. But symptoms like tooth pain can indicate serious health issues. A tooth infection can affect the heart and even the brain if they're not treated. And
Mhm.
so when we think about oral health, these issues can also have a huge impact on women's pregnancies
That's
because
right.
research has shown us that gum disease may be linked to preterm birth and low birth weight. And so we need to continue to have conversations like this.
That's
It's
right.
really about educating people and spreading awareness and advocating for dental coverage for everyone.
Thank you so much. And I will tell you, the level of the way in which you've educated yourself on this issue, I am just really floored because we don't often hear about our leaders speaking about this connection between oral health and overall health. So really appreciate you and your team for lifting that up. It is a matter of education and it's something that we are joined at the hip in trying to advance. So really appreciate that. Additionally, appreciate your leadership on the Mommies Act and improving Medicaid and Medicare dental coverage. Where do you see the biggest opportunities in our current political environment to make progress on these critical maternal and oral health quality issues, equity issues, quite frankly, as we continue to build support?
Well, first of all, I believe that it's critical to continue building the momentum to get these critical measures passed,
Mhm.
which we do again through conversations like this one, conversations that we have with organizations like yours, as well as conversations that I have with my colleagues. Now, I've seen more press lately on the maternal mortality crisis in the past few years than I have in a decade. And
Yes.
so it's put pressure on lawmakers to act urgently and to address the crisis. And I've got to tell you, sometimes we don't act until constituents put pressure on us. But we've
Mhm.
already seen progress. For example, in my home state of North Carolina, we extended postpartum Medicaid coverage from 2 months to a full year just
Yes.
a few years ago. I
Yes.
worked for 20 years in the North Carolina House trying to expand Medicaid, and they finally did it. But I
Mhm.
believe that there's a lot of opportunity to work with our state legislatures to continue that expansion. Of course, the White House administration has also funded excellent maternal health initiatives through the NIH and HHS. So
Mhm.
recently, over $100 million of funding was signed into law to further address this crisis. And so as we continue to work very hard to get these bigger pieces of legislation passed into law,
Mhm.
this funding is going to be critical. So it has been a priority. It's been a priority that the White House has taken on. And I think if we continue to do what we're doing, to work hard, to educate, and so forth, I think we're going to get there.
Yeah, I appreciate your saying that this is one of the first times that you've seen this level of attention on this issue. And it does then really become more of a bipartisan issue. None of these things should be partisan. We are talking about healthcare, which is not a partisan issue. And so
Absolutely.
the fact that we have leaders across the aisle, on both sides of the aisle, I should say, lifting this up and hearing from their constituents, it empowers us as constituents to demand this, quite frankly, of our leadership and to support the work of leaders like yourself and others who understand that this issue impacts us all and that we
Oh,
really need to understand how we can continue to advance health equity as a means of lifting up all populations. So thank you for acknowledging that and the role that constituents have in really demanding action from all of our leaders. We also appreciate your leadership in terms of the Kira Johnson Act. You are the primary sponsor for that, a bill that aims to confront the Black maternal mortality crisis head on. Can you tell us more about that legislation and the community-based organizations involved?
Well, this bill was named after Kira Johnson. Kira was a woman who lost her life to Black maternal health crisis, not because she was unhealthy, not because she was uninsured or unlucky, but because she was unheard. And so in 2016, Kira Johnson checked into a hospital with her husband, Charles, to give birth to their second son, Langston. She was an entrepreneur, world traveler, mother of one healthy boy already, and a Black woman. And she didn't make it out of that hospital alive. She died from hours of neglect and severe hemorrhaging, nearly 12 hours after delivering Langston. She deserved better. Her life mattered. So in honor of her, I worked with her husband, Charles, and the organization that he founded, For Kira, For Moms, using the number 4 to create this legislation. And so we took input from many different advocacy groups, making sure to include the voices of Black mothers and families and physicians, midwives and doulas. And so the Kira Johnson Act gets at the core of this crisis because it's going to fund grant programs that implement racial bias training. It's going to provide funding for community-based organizations that support doulas and midwives and other perinatal health workers. It's going to address social determinants of health, like housing and transportation and nutrition. And the fund, it's going to fund respectful maternity care programs in hospitals where pregnant and postpartum parents can report instances of racial bias, and that's really key. So it's important to me that we talk about bias in maternal care because I believe that Kira's care team needed this training. And it's not only about preventing that 80% of the maternal health deaths that we think are preventable, it's also about improving the quality of care.
Yeah, thank you so much. 80%, we believe, are preventable. I mean, when you think about how large that number is, these are the types of actions that we need to take. I think back to my own experience in medical school as an internal medicine physician, and we did not talk about equity. We didn't talk about recognizing many of the things that I know the trainings that will be conducted under this act will allow us to take advantage of in understanding bias. So I'm just so grateful for your leadership in taking this on and taking on maternal morbidity and mortality and all the various ways that you're doing that and looking at each of the different specific levers that we know we can pull to be able to make a difference, from ancillary providers like doulas to training to education to even just sharing Kira's story. And so what a powerful story to share, and all of the things that we can learn from that are things that will help to lift us up and to help us to continue to move forward.
Yeah, you mentioned the 80, I mentioned 80%, but 2 years ago it was 60%. So what it tells you is that it's getting worse.
That's right. And that's
It's a
intolerable.
crisis, and it's really escalating.
That's right. That's right. From your perspective, what is America's next step towards improving maternal health and decreasing racial health disparities? We've talked about a lot, but if you think about what does America need to do, what do you see as those key next steps?
Well, we've got to, first of all, get at the root of the crisis. We've got to address what we call social determinants of health, access to nutritious food, transportation, affordable housing, because these factors, alongside the racial disparities in care, affect both the mother and the child before and after birth. And so we need to see the full Momnibus package passed into law. Comprehensive approach to this crisis. It does address those social determinants of health, implicit racial bias in the medical field, and expanding the diverse and diversifying the midwife and doula workforce. But we've got to empower the community organizations that are already doing this great work on the ground by providing the funding that they need to do it. It's really about getting them the funding. They're already interested in working, even to some extent, with little or no funding. And so we need to expand access to health coverage for everyone, including access and expanding dental coverage.
Thank you for that. Thank you for that inclusion. It's such a critical part of how we think about healthcare writ large. And I love your point about investing in communities and investing in community organizations that are doing this work. We have so many key proof points in our communities of organizations that understand the needs of the women of the community and are making significant strides. And they're often the ones that get the least amount of funding. And so I love your comments around ensuring that those organizations who have demonstrable results actually get access to dollars that they often haven't had that level of access to. So you mentioned food. So let's turn to some of your work in nutrition. So let's turn to some of your work related to food access as a member of the Committee on Agriculture. According to our research, individuals experiencing food insecurity were more likely to have poor oral health, more likely to lack dental insurance, and less likely to have visited a dentist within the past year. What are your thoughts on this connection between food insecurity and oral health?
Well, I have this habit of saying, excuse me, you can't be healthy if you're hungry. Now, your research is right to suggest that there is a connection between food insecurity and poor oral health, especially when we remember that poverty drives both of those outcomes. And not only that, but the kinds of foods that meet the price point of someone trying to stretch their dollar or save on time might not always benefit oral health. And that's why SNAP and other programs in the jurisdiction of the Ag Committee, and I've been on the Ag Committee ever since I've been in the House, that the jurisdiction of the Ag Committee ought to ensure that participants have a greater benefit and can buy more nutritious food. In fact, that's the argument of my bill, Closing the Meal Gap. And because it does a lot of different things to improve SNAP. And one of the things is that it ensures that a higher amount of income is spent on medical care. If you spend it, it cannot be counted against someone in calculating the amount of SNAP that they ought to receive, because you need medical care. And we shouldn't penalize you in terms of the food support that you need. And so that medical care can include dental care bills, or money spent on dentures, or even travel costs to see a dentist, which will all benefit oral health. And so this bill increases that deductible amount from just a measly $35 in medical expenses to $140. And that makes the amount of SNAP dollars that someone would qualify for even greater. And so that's a good thing. And the bill would also base how SNAP benefits are determined on a more realistic food budget that reflects the cost of food and current nutrition science. And that would, of course, increase SNAP beyond that mere $6 a person a day that it is right now on average. And some people don't think about that. That's $2 a meal. That's absolutely ridiculous. So recognizing how people should not have to make an impossible choice between paying for food and oral health is actually in a way what we're doing with this bill.
So I just wanted to double down on a couple of things that you said. One of which is that the dollars that you spend on healthcare can be held against you when it comes to the calculation of your SNAP benefits. That seems so counterintuitive to most people, to think that your healthcare, the dollars you spend there, could then take away from your ability to afford food. And so the fact that you are lifting that up and providing education and visibility into this construct that is really set up to help people to fail. I mean, it's almost impossible to be healthy, to worry about the dollars you spend on healthcare being connected to the dollars that are available to you to buy healthy food.
Absolutely. I've just seen that when it comes to the poorest of the poor and people who are struggling, we don't have the kind of, in my opinion, I'm talking about elected officials, we often don't have the sensitivity that we need to have, because, if my belly hasn't growled because I'm hungry, I don't understand your pain. That kind of thing. So, we've got to sensitize people a little bit more. And I think a lot of that's going to have to be taken up by the constituents.
Yes.
You go to the polls, you're going to elect people, you need to know where they stand. Are they going to stand for you? Are they going to stand for those things that are important to you and to your family and your community?
That's so true. And again, you're highlighting this role that we as constituents have. We often feel powerless when legislation or policy gets enacted, but we really do have ways in which we can become empowered, in which ways in which we can influence the decisions that the leaders who represent us make. You also lifted up $6 a day,
Yeah.
and I cannot imagine in $2 per meal, as you lifted up, if you were going to split that between breakfast, lunch, and dinner. I cannot imagine the struggle and the choices that people have to make when it comes to that existing $6. Understanding that it's typically the most unhealthy foods that are in that price range, and it's so much harder to afford fruits and vegetables and nutritious foods. So as you were constructing this, the work that you're doing now in the Committee of Agriculture, I'd love to understand from your perspective, what were some of the stories that you've heard from your constituents about this and this, about the construct of how SNAP benefits are allocated?
Well, first of all, it's very difficult, as you say, for people to get the nutritious food that they need for themselves and their families if they don't have the dollars to do it. We've got to go back to making sure people make a living wage, not a minimum wage.
Mhm.
But that's a concern. People are making sacrifices and making choices, and the choices are not good choices because they don't have the amount of money to do what they know that they need to do for their families. And so and in many cases you have, in some of these communities, you have all these food deserts and so forth. And so they have to take what's available. What's available, they may be able to afford with that $2 and they may not. But in most
Mhm.
cases, they cannot make the ends meet in terms of the food that they need to provide for their families.
Yeah, you lifted up food deserts, and that is one of the ways in which we describe areas in our country where there are poor access to fresh fruits and vegetables, poor access to a grocery store. Different cities and different towns manage that in very different ways, but I think the central point is there just isn't enough food, healthy food that's available without having to go outside of your community. Um, we know that Black and Hispanic respondents in particular are the most likely to worry that their food would run out before being able to afford more, whereas white respondents are the least likely. How do you think food security ties into Black maternal health outcomes, since we go bringing us back to the first topic?
Yeah. If we want to improve maternal health outcomes, first of all, we've got to look at the full picture and everything that can affect our health, including food security. And so if we're talking about food security, we have to acknowledge the systemic racism that causes Black and Hispanic communities to be less likely to have that food security.
Mm.
These food deserts, as we've mentioned, they don't happen by chance. They are a direct result of policy that historically sought to exclude Black and Hispanic populations from public investment. And so if we want to have better Black maternal health outcomes, we need public investment in our communities, from nutrition to housing to transportation. Because when moms have access to nutritious foods, they're able to have a healthier pregnancy and their children are able to have a healthier life. And that's what we want. We
Mm.
want healthier communities. We want these mothers to have a healthy pregnancy, and we want the children to be able to have a healthier life, because that's where it begins.
That's right. It was at the very beginning. And as we talk about, Black and Hispanic respondents, we're also talking about white respondents in incredibly rural and poor areas. And when we expand these types of benefits and these types of opportunities for education and investment, we know that we're going to be lifting up those individuals who are white, who are poor, who also have poor access and also live in food deserts. And so as we think about this being an issue of health that is affordable and accessible and integrated for all, it's really important that we don't lose that, because I know some of these things become more partisan depending upon the populations that we talk about. And I'd love to understand, how do you continue to drive that to make sure that this is a bipartisan issue? What are some of the stories that you lift up and that your team lifts up in order to ensure that we have buy-in across on both sides of the aisle?
Well, the first thing I emphasize always is healthcare it should not be available for a few. It should be available for everyone. should be accessible. It is not a partisan issue. Education should not be a partisan issue.
Correct.
Housing should not be, all of these things. And so I impress upon my colleagues oftentimes, look in your communities. Look at the people that you represent. Some of them, enough of them voted for you, so you got elected, but some of them probably didn't. But either way, you represent everyone. That's the oath that we take. I represent 700,000 people in Mecklenburg County and a portion of Cabarrus County here in North Carolina. A good number of the folks voted for me so I could get elected, but some did not. But nevertheless, I still have a responsibility to each and every person. And I think we have got to change the mindset sometimes of our elected officials. I have tried through not just this caucus, but I have a bipartisan HBCU caucus that we started because a lot of our schools, for example, are in Republican districts, number one. Education, again, it should not be a partisan issue. Right. You know, education is the pathway for everyone who wants to take that walk. So I think it's really about, you know, I was an educator for 40 years. I taught on a small women's college in Greensboro, North Carolina, Bennett College. And so, you know, it's all about educating and advocating. And even as members of Congress, as an elected official, I've served in 4 elected offices. But once people elect you, then you have a responsibility to work on their behalf, and that means you're going to have to work with your colleagues.
That's right.
And they may not always see things as you do, but you're going to need their support, and at times they're going to need yours.
Exactly.
So I think we have to, you know, we have to engage our colleagues in that way to help people understand. But I think if they point to, we can pull people out in their communities who can talk about these things, who may be of a different political affiliation. But the point is, you have a responsibility to serve. It is the rent we pay.
Yes.
Living on the third doctor. I'm sure you know that.
I do. And I so appreciate that. And bringing us back to the beginning, healthcare is a human right. And I really appreciated your lifting that up when we began this conversation. And I just, again, want to just express my gratitude for you, for your time, for your passion, your dedication to health equity, maternal health, and oral health. This has been an absolutely terrific conversation. I think we've uncovered some practical ways that we as constituents can support you in the work of your colleagues to advance meaningful health equity policies. I'd also like to thank everyone who tuned in to this episode of Chew on This. Please be on the lookout for our next critical conversation as we continue to elevate key issues and actions to advance health equity and expand access to care. Thank you again, Congresswoman Adams. It was an absolute honor and pleasure to meet with you. And please keep doing the work that you're doing, and know that there are so many out there who are supporting you in your efforts and are excited to engage in those efforts to make healthcare better and a human right that everyone has access to. So thank you once again.
Thank you, Dr. Myechia Minter-Jordan. Thank you so much for all of your work, and I look forward to meeting you in person sometime soon. God bless.
Yes, ma'am. You as well. God bless.